So let's talk about Tysabri, also known as Natalizumab from the generic name. Tysabri is a drug, monoclonal antibody that was actually approved in 2005 for the treatment of MS. At the time, it was one of the most effective therapies that we'd ever studied. However, shortly after its approval by the FDA, there were some safety issues associated with a brain infection called PML that I'll return to in a minute. And so it was taken off the market for less than a year and then reintroduced in 2006 with new guidelines for monitoring safety. However, it has been increasingly used in recent years to treat patients, and right now there's over 100,000 people in the world that are being treated with Tysabri. As I said, Tysabri is a monoclonal antibody. And the way that it works is it binds to a protein that's on the surface of immune cells. This protein is called VLA4 or alpha-4 integrin. It's part of a family of proteins that are involved in the ability of immune cells to stick to the blood vessel wall and migrate into tissues. This occurs in brain as part of the inflammatory process that characterizes the disease, multiple sclerosis. The VLA4 on the surface of the immune cell binds to another protein on the surface of the blood vessel called VCAM1, and that allows the immune cell to really bind to the blood vessel wall and then migrate through into the brain. And it turns out that that protein is particularly important in humans in the disease process of multiple sclerosis. It doesn't kill cells, it doesn't remove the immune cells from your system, it simply blocks their ability to get into the brain. So all of the effects of Tysabri are reversible if you stop the medication. And within a matter of 2 months, your immune system is essentially the same as it was before you were treated. Tysabri, the studies on Tysabri use relatively modern techniques in terms of monitoring the outcomes of the therapy. It reduced the annualized relapse rate, which is the number of attacks people are having per year of MS, by 67%. And at the time, that was one of the largest effects we had seen. It also decreased the probability that patients would worsen by 1 point or more on a disability scale that we use called the EDSS scale by 35%, which was also a fairly large treatment effect. And then in terms of brain volume, which is a very important outcome measure because it predicts the future, it decreased the rate of brain volume loss by 45% in the second year of treatment. So these are all very good numbers. However, there are other ways of thinking about the medication which I think are also important. One of those is the probability that a patient will be free of any evidence of ongoing MS disease activity. And some studies have suggested this rate might be as high as 50% for some patients. There's also the probability that patients will actually improve in function over time being on these therapies. And there have been a number of small studies done throughout the world that report that on average, MS patients are actually improving in terms of symptoms like fatigue, cognitive problems, depression, motor function, ability to walk, vision. And this is the first time that we've had an agent that actually seems to actually allow patients to improve and recover function. From a tolerability standpoint, this is a once-a-month IV infusion. Generally, patients have little in the way of side effects from it, but sometimes patients do report that they can get an infusion reaction, which is an allergic response to the drug that can consist of a skin rash, low-grade fever, tightening in the throat. They also can complain of headache for a day or so afterwards and fatigue. From a safety standpoint, the key issues is this brain infection called PML. It's associated with a virus called John Cunningham virus or JC virus. Again, about half of people with MS have that virus, and that needs to be assessed before the therapy is started. And in general, if patients are positive for the JC virus, I would suggest they might want to look at other agents first before considering Tysabri as an agent. But if they're negative, then Tysabri's safety has really been quite good and quite comparable to the other agents. The other problems are liver toxicity and potentially infections. The risk of these seem to be quite low. We rarely see that, but with many drugs, like many other drugs, that's a potential risk with Tysabri. And then there's a very small risk of a serious allergic reaction to the infusion called anaphylaxis. There's only been a couple of cases reported so far. From a monitoring standpoint, the important things about Tysabri is to monitor whether patients have the virus called the JC virus. If you're negative for the virus at the beginning of treatment, you have about a 3% chance of getting the virus and developing the infection every year. So that's why it's important to monitor again every 6 months to make sure that if you do convert to positive, that you can reconsider the safety of the drug. We also do complete blood counts and metabolic panels every 3 months. And we also do use MRI to monitor treatment effect, both in terms of new lesion and in terms of brain volume. So in summary, Tysabri is a drug that's been out for a number of years now. We have a large experience with it. We know a lot about how this drug works. And in the appropriate patients that are appropriately selected, it can be a safe and highly effective therapy.